Pour la 4e année consécutive, le Forum Galien Afrique se déroule en terre sénégalaise du 7 au 11 décembre 2021. Le Forum Galien Afrique offrira une plateforme d'échange exceptionnelle autour du thème « L'Afrique se mobilise pour la sécurité sanitaire mondiale ». Placé sous la présidence effective de son Excellence Macky Sall, président de la République du Sénégal, le Forum Galien Afrique réunira des experts scientifiques des secteurs de la santé, de l'environnement, d'éminentes personnalités politiques et de la société civile, d'anciens récipiendaires de prix Nobel et des centaines d'étudiants en médecine. Cette 4e édition du forum, avec 3000 participants, sera organisée en format virtuel et placée sous le signe du leadership des femmes et des jeunes, avec du 7 au 10 décembre 2021, un forum des jeunes, un forum des femmes et un forum scientifique. Le samedi 11 décembre 2021 se tiendra une cérémonie en présentiel pour célébrer les 50 ans du Prix Galien International et le Golden Jubilee. Au cours de cette cérémonie, pour la première fois, le Prix Galien Afrique, qui consacre la recherche, l'innovation, la santé et la technologie, sera décerné. Du 7 au 11 décembre à Dakar, le Forum Galien Afrique célèbre la santé, l'innovation et la recherche en Afrique.
Dear participants, youth leaders, scientists, welcome to the 4th Galien Forum Africa. Cette session sera en anglais, mais vous avez la possibilité de choisir la langue de votre choix en cliquant sur le bouton Interprétation en bas de l'écran. As you may know, and as it was said in this video, the Prix Galien was awarded for 50 years and is positioned as the counterpart of the Nobel Prize for pharmaceutical innovation. And let's remember this word because we'll come back to it very soon. Since 2018, the Galien Forum Africa has been working to strengthen research and sustainable development by sharing experiences in the face of major public health issues. This crucial forum offers a platform for high-level but also informal discussions and dialogues between established scientists and young leaders and researchers. I am very pleased to participate in this forum, led by Speak Up Africa champion and woman African leader and role model to a lot of us, Professor Awa Marie Kolsek, chair of the scientific committee of the Galien Africa Forum. I also want to salute her team, which is doing a wonderful job to make this platform as diverse, as inclusive, and as innovative as possible. We are gathered today to discuss health innovations led by young African, and more broadly, we are here to discuss youth and global health security, as the overall theme of the Galien Forum Africa is Africa Mobilizes for Global Health Security. Last year, on the exact same day, and the International Federation of Pharmaceutical Manufacturers and Associations, also called as IFPMA, which represents the research-based pharmaceutical companies and associations across the globe, and Speak Up Africa, a brilliant not-for-profit organization based in Dakar, Senegal, which I have the chance to work for, launched the first ever Africa Young Innovators Award for Health. This flagship program focuses on supporting pioneering young health innovate entrepreneurs across Africa with financial and in-kind opportunities to develop their business ideas. The first edition of the award was designed to advance promising solutions to support, equip, protect, and train healthcare workers who have been working tirelessly to protect and treat the public amidst the COVID-19 pandemic. On September 16 this year, Conrad TANKOU from Cameroon, CEO of JEUNES, Mme MWANGI from Kenya, CEO of Daktari Media, and Imodoye ABIORO from Nigeria, CEO of Healthbotics, were announced the first ever winners of the Africa Young Innovators Award. As the winners, they will benefit in-kind financial support, in-kind and financial support. They're also partaking in a 3-month business mentorship program and received a media training. Finally, they also gain access to a network of supporters and partners working across digital, healthcare, and media. I am very pleased that they will be able to answer our questions today and hopefully inspire other young women and men to develop innovations dedicated to improving public health and living conditions of African populations. Before our interactive discussion begins, I'm very pleased to introduce to you Dr. Karim BENDHAOU, Chair of IFPMA Africa Engagement Committee, for his opening remarks. Dr. BENDHAOU has served as the president of North and West Africa operations for Merck for over 18 years. And since 2019, he is the chair of the Africa Engagement Committee of IFPMA. This is really an honor to have you with us, Dr. BENDHAOU, and the floor is yours.
Thank you very much, Mme. Maëlle. Ladies and gentlemen, dear attendees. It's an honor for me and the innovative biopharma industry, which I represent as the chair of the Africa Engagement Committee, to welcome you to this panel discussion on the future of innovation in Africa, featuring the 3 winners of the Africa Young Innovators for Health Award. 1 year since its official launch at the 3rd Gallian Forum last December in Dakar. This past year, we have been truly amazed by the vibrant innovation that have been submitted for the award. But first, let me explain why we have launched this initiative with our partners. Obviously, Africa is the youngest continent on the planet. By 2050, Africa's youth population, aged between 0 and 24 years old, will increase by nearly 50%, which can be an incredible opportunity for rapid social and economic transformation. According to the African Bank of Development, the ADB, 1 African out of 5 working age population are starting businesses. That's amazing. This is the highest entrepreneurship rate in the world. However, it is often lack of financial resources to build a viable business for the initial idea that create significant hurdles, and this is especially the case in the health sector. Can you imagine that there is 140 billion funding gap for startup and small and mid-sized enterprises in Africa? There is therefore a pressing need to foster an innovation ecosystem and to invest in the innovation capacity of this generation of young people to deliver more and better healthcare solutions. At the same time, we need to encourage more young people to choose the path of science and technology. This was the underlying reason for focusing the award on supporting young entrepreneurs to innovate in health and be the engines of economic development in the continent. The Africa Young Innovator Award for Health is an investment in promising African entrepreneurial youth. It is co-sponsored by IFPMA and Speak Up Africa with the support of a group of African stakeholders from health, business, and digital, who believe in the power of African youth to solve the health challenges of our continent. In its first edition, the award has received more than 300 applications from 33 countries across Africa. Eligible applicants had to be between 18 and 35 years old. The selection process considered how innovative, scalable, sustainable, and commercially viable the applicant's idea in its ambition to support, equip, protect, or train healthcare workers at the front line of delivering healthcare to communities. This review also assessed the ability of the team to take the innovation to the next stage of the development. I'm really proud to have been part of the jury of this first edition and can testify firsthand of the quality of the application received. Indeed, young Africans are bursting with ideas and have a well-developed acumen to come up with innovative solutions that work on the ground. The award provides financial and in-kind support for young innovators, and as mentioned already by Maëlle, to develop innovations dedicated to improving public health and living conditions of African population. The first prize is 40,000, the second is 20,000, and the final prize is 15,000, which is provided to support them in developing the idea further beyond the concept stage. On the top of that, a 3-month mentorship program is also a key part of the winning package, in which 3 of our business mentors will be partnered with an award winner to provide mentorship over 3 months. And as a part of the program as well, the award winners who require it will benefit from technical support to protect the intellectual property asset, which is key. And of course, this is a great opportunity to increase the visibility of the innovation, receive media exposure, and develop the network amongst business leaders and healthcare experts and organizations. But above all, the award is a demonstration of what a vibrant private sector can deliver to respond to the public health problem. In the following hour, we will have the pleasure of meeting our award winners and finding out more about their innovation, motivation. This is a brief introduction of each one of them. The first prize winner is Conrad TANKOU. Conrad is the CEO of GIC Space, developed 5 proprietary medical technology energetic med platform to remotely screen and diagnose women for breast and cervical cancers. The second prize, Mme MWANGI. John is the CEO of Daktari. Daktari Media invented Daktari Online, an online medical learning platform that offers continuing medical education to healthcare professionals. The third prize winner, Imodoye ABIORO, is the CEO of Healthbotics, and not biotics, created an AI-powered electronic medical record system, Mediverse, which is built on blockchain and allows health workers to input and retrieve patient record with their voice, working with or without internet access. These young people clearly represent the new generation of Africans, bursting with innovative ideas and the entrepreneurial spirit needed to thrive. It also highlights the importance of providing support and mentoring young African innovators as part of the solution to the biggest health challenge the continent is faced with. USC 2030 cannot achieve without them. We hope they will inspire others to develop innovation dedicated to improving public health and living conditions of Africans and help heighten attention to the place of African innovation in global health security. Thank you very much. Over to you, Maëlle.
Thank you so much, Dr. BENDHAOU, for your opening remarks. This was very, very important. And thank you for reminding us, that according to the African Development Bank, 22% of Africa's working age populations are starting businesses. This is the highest entrepreneurship rate in the world. And this is not something that we hear too often, usually of our continent or on the continent. Usually the narrative is different. And these numbers are super powerful. And the first edition of the Africa Young Innovators Award proved it to us. From cold storage solutions to diagnostic tools, electric health records, 3D printing solutions, mobile devices, and training platform for health workers. We were very, very impressed by the applications we received. And we are definitely convinced, IFPMA and Speak Up Africa, that by looking to young people, we can find workable solutions for healthcare workers or healthcare system strengthening. Dr. BENDHAOU, thank you also for introducing the 3 winners of the first edition, Conrad, John, and Imodoye. I suggest we dive in directly in the subject because I'm sure the 3 of you have a lot to say, and we are all very eager to hear from you. So I will start with Conrad. Conrad, nice to see you. Can you hear us?
Perfect. Thanks, Maëlle. I can hear you well.
Great, thank you, Conrad. So your innovation aims to enable women living in Africa in communities where health structures do not have the tools to detect breast cancer, a disease which is one of the leading cause of death amongst women on our continent. How did you come up with the idea of this developing this innovation, and what were the major obstacles you met while developing it? But also, what were the lessons you learned when you overcame these obstacles?
Well, thank you, Maëlle. It's always interesting sharing this story, and I can see it ties a lot with the whole philosophy of the Young African Innovators who held award, because I mean this award tries to support solutions that are supporting frontline health workers, and that's how I actually came up with this solution, because I was actually a health worker at that time, and I got inspired to build this, and it's. Back in about 2015, I was already involved in the health tech space, in the social entrepreneurship space, because I'd already co-founded a series of health tech ventures, which were working pretty well. And at that time, there was no idea to build anything with breast and cervical cancer. But what happened was I was working as a frontline doctor in a rural community back here in my home country, Cameroon. And it happens one of the women who welcomed me into that community died of cervical cancer. But that was not the clicking moment. That didn't mean anything at that point to build something for cervical cancer. A few months later, I remember I noticed that the concept of cervical cancer came up, and actually realized that almost no woman in that community had ever had opportunity before to be screened for cervical cancer. And I was actually the second medical doctor to ever work in that community. And the reason was obvious. There was no skilled health professional before then for a long time to really attend to these women for critical health conditions like this. So at the start, as I said, it was not actually building a solution for this. What I did first was organize a massive screening campaign, which was free for cervical cancer in that community. The first day, 250 women turned up. That was terrible, because we didn't plan for that so much a crowd. And we didn't have a lot of workforce. So at the beginning, I was like a one-man army. So I learned the lesson, and because we could not attend to all the women that day, we had to organize all the sessions. But it happened that along the line, news spread, and from neighboring villages, they heard about people screening for cervical cancer. So some of the women started coming to where I was working, but we started receiving calls to come and screen in other villages as well. So being somebody who hardly says no, I had to find a solution. And still there was nothing revolving around tech or around building a solution for cervical cancer. But what I found at that point was trying to mobilize my colleagues who were young doctors to find probably a free time, and then we organized and then moved to those communities to screen. And that's what we were actually doing. But it was very, very stressful to move there, to screen people, move from here to next, and of course, it was not sustainable. And yeah, that's when the idea came in to build actually a tech solution, but that was to help reduce my stress of screening. So it was not about a global solution. And the idea at that point was building a solution where the data which we normally go there to observe to place a diagnosis, for example, could come to me at the central point, and I can easily manipulate things around. And there we came up with the first idea to build a solution around cervical cancer. Currently, we have 5 different solutions now, but at that point, we had just one thing. And we didn't set up to build all these 5 different solutions. Along the line, those solutions just came up. So talking about challenges, the first challenge, of course, was building a tech solution which is actually adapted to the context and which could serve the need. And that context was rural communities where electricity is a problem, internet connectivity is not that adequate. So the solution had to be adapted. That was a challenge, but to solve that challenge, the best thing was obviously putting in place a team of diverse minds, passionate guys, engineers especially, to build a solution. That's where I'll cite the second problem. What do you find these guys? Of course, you can say they don't really exist. Some key engineering talents don't exist and are not very rampant to find in Africa, but you actually find some of them. But the problem is those you find don't have this entrepreneurship mindset of trying to innovate and build and create solutions and test and stress and fail and things like that. And I remember the first team I had, most of the guys left when we had our first challenges, where we built things and we went and we tested and it didn't work. So it's not going to work, they will just give up. So that mindset, finding first of all the talents, and then finding people with the entrepreneurship mindset who are ready to toil and stress and accept failure and build on failure was a very big problem. But we kept on going. And at a certain point, yeah, we had a solution which revolved around cervical cancer. And things were moving well. But I mean, it was still an immature stuff. And as I said, it was built around me because I was trying to reduce my stress. But now the idea came into, because cervical cancer is actually, at that point, I think we're talking about the second most common cancer in Cameroon. But breast cancer was a bigger problem. And we said, but it's about exploring our skills, exploring our talents, leveraging on technology and doing things. Why don't we add in breast cancer so that building a solution that targets both of them would actually cater for 50% of all new cases of cancer, and that's huge impact. And being someone who is very obsessed about impact, I decided to take that very difficult challenge. I mean, not having the perfect solution for cervical cancer, but adding another problem on that. So I decided to find guys, build a team of technology guys, and we're building the solutions gradually. And now the third challenge comes in. The technologies are tech-oriented. And I would like to divide the technologies into two parts, software and hardware. Software was quite easy to navigate because, I mean, you can be based anywhere and have access to software tools, but hardware was a hard nut to crack. And that's something I never imagined, because in Africa, we have no basic infrastructure to manufacture hardware products. Talk of health technology products, that was really challenging. And that's, I mean, it took us a lot of time to brainstorm, prototype, pilot, test. It took us a lot of time. Just to give you an idea, there were some hardware tools where we had to 3D design and send the model to China, and then receive the models and test. And just that timeline could take about 2 months. So just imagine if you fail, means you've lost 2 months. So that's, I mean, it was a big challenge at that point in time. But building a team gradually of guys who are really passionate about that, and then try to leverage about the manufacturing and logistics system actually led us to continue building gradually. Now it came, after we had the prototypes, it came to testing. How could we test? The best means of testing, I mean, of implementing the project was actually designing a model where we can easily scale. And that was, that came in the aspect of leveraging on the current health system to scale. And the health system actually is health facilities and the frontline nurses. So we actually had to use them as the best means to implement the project. But now, how do you give new technologies to frontline nurses who are less skilled and less trained to implement? And there, the idea came into bringing another product, which was actually conceiving an efficient training system to train these frontline nurses so that they can actually, be frontline implementers of the project. So, integrates the concept of task shifting and skills transfer so that they can actually be empowered to implement the project. So, but still, it's 5 minutes, it's short to talk about it, but along the line, there are challenges everywhere, because even the training model at the beginning was about physical contacts with these health facilities, but you go there and train. If you have to move to 100 health facilities, you cannot go to 100 places. It's not sustainable. We came in with an e-training model, but the first e-training model was videos and text, and it was too boring for them. Follow up, we had to innovate there, and now we have a solution that integrates 3D simulations and gamifications just to make them more attractive and more engaged towards the learning. So it has been a gradual process, but the main lesson is this: we accepted failure at every point in time, and we didn't take it as a challenge, because we have 5 different solutions now, but we didn't set up to build these 5 different solutions. The challenges we met actually motivated us to build each and every one of them, and I can say it's the mindset at the end of the day of the team I finally got in place, because it has been guys who could, sometimes it's better not to bring somebody to your team who could bring negative energy and work probably alone, than bringing people who are going to break down your energy and bring in negative mindset. But currently it's a strong team now made of young guys who are thinking in the same direction, who are all devoted towards the project, building solutions which are adapted, and we're testing and upgrading progressively. And we keep on facing challenges as well, but I'm braving them. But now I'll just comment on the future challenges, just to wrap up. And that has to involve in move around health technology in Africa, because regulation and lack of regulation or regulation which is not harmonized limits scale of projects like this. For example, in the US, you have the FDA, in Europe, you CE mark and things like that. But in Africa, we don't have a harmonized system, and that can really slow down scale and implementation of very interesting projects which have great potential. And those are things that we're trying to envisage and see how to pivot around. And for now, just to give a hint on how we are trying to face things like this, it's not actually look at our solutions as just African-based or African model, but global. Why not have an international certification, an FDA registered product as well, which can be globally accepted in such a way that you can navigate all this probably a lack of regulatory system or unharmonized regulatory systems in Africa. So now it's actually moving ahead and thinking global, and yeah.
Well, thank you so much, Conrad. I think you you went to other questions, but it's great. Thank you so much. So what I gather from what you said is that you have to find a passionate team find passionate individuals, build a strong team, be patient, accept failure, overcome stress, because you've talked a lot about stress, and I'm sure being an entrepreneur is like very, very stressful, and also making sure that people are rightly trained to answer the needs of the communities. So thank you so much for your answer, and I will now turn to John. And it's great that you talked about training, because John, you've the training and support of community health workers is very important to best prevent and heal communities on our continent. And you are the only online training service accredited by Kenya's Medical and Dental Council. What do you think makes your platform different from the other online medical platforms? And how did you achieve this accreditation, and why developing a training platform for healthcare personnel? That's a lot of questions.
Quite a lot. Eh? Thank you so much, Mel, and thank you even for having us here. First of all, I just want to allude a few statistics I came across while I was starting to do research on this. 78% of specialist doctors in Kenya, at least, were based in the capital city, Nairobi, while Nairobi only hosts barely 10% of the population. What that meant was that there was knowledge that was centralized or so was somewhere only in the capital, yet the rest of the country suffered from new knowledge and new skills. And that's one of the reasons why we began this. My partner, who we joined hands, is a doctor. Myself, I'm not a doctor, I'm a technologist. So when he shared what they were experiencing in terms of training and how disjointed training was across the country, how their counterparts in the cities had the privileges, and this really translated into the kind of care that it was received at the villages or at the far-flung areas from the city. What eventually happened was there was a lot of referrals to the city. This increased cost of care to patients, and this again was training the hospitals in the city. And when we're looking at all these scales and all this scenario that as I was researching, I came across, I realized one of the biggest things that would help solve the issues was distribution of knowledge. When all these specialists are centered in the capital, how do we use their knowledge and the skills and make it available to their counterparts in the other areas, so that to reduce the number of referrals, consequently reduce the cost of care for patients, and even improve the kind of care that the healthcare providers delivered, even across. And that's how we came up with Daktari.
Les soins de santé qui sont dispensés, c'est ainsi que nous avons mis en place.
This was we came up with a platform that allows democratization of knowledge.
Sorry, John, just 1 second. Buba and team, can you please mute Alfred, because he's on our session and I don't know why. Thank you. Sorry, John, go ahead.
Thank you. So when we came up with this product, with this solution, we sought to democratize the knowledge sharing among healthcare workers. And this was way back in 2015. And When we began, we didn't know, we started just as a way of self-evaluation, allowing them just to measure what they knew. And traditionally, they used to meet in hotels to do the continuous medical education sessions. And we said only the few, the 50, the 70 that could gather in the evenings in the hotels had access to this knowledge. How about we distribute this knowledge to the many who not, maybe some who are in session or who are in their shifts at the hospitals. And that's how we began that. So how different is our platform? One, when we began as a doctors only platform, and we learned quite a lot when we did this. But over time, we realized care has many aspects of it. The nurses are part of the care, the lab are part of the care, the pharmacists are part of the care. And over time now we have evolved. When you introduced me, you said we are the only accredited by the Kenya Medical Practitioners Council. Now we are accredited by the Pharmacy Board here. We are accredited by the Nursing Council, and we also accredited by the clinical officers, which is equivalent to physician assistants here. So that just shows you how we've grown, and we are thinking of care as a part of, it's a care that is for all, multi-sectoral. So that's number one. Majority of the solutions that you may find, most of them either are specialty-based or cadre-based, but ours is multi-cadre. The other thing that we realized was an issue was how the regulators tracked training for health workers. This was a big issue. We realized that there was a lot of disjointment when the healthcare providers went to renew their licenses, because it's mandatory for them to renew their license, and for them to renew licenses, they're required to show evidence that they learned. This was a challenge both to the regulator and also to the healthcare providers themselves. So through the platform that we have, we integrated our system with the regulator system, so that they can easily track any healthcare provider across the country as they learn. Anything they learn on our platform, the regulator can get an update almost real time. And that saved the healthcare providers time, because they used to get certificates. Then at the end of the year, they would just print all those certificates and take them to the regulator. Then the regulator would have to have a committee that would sit and look through to verify whether it was true. And this was a lot of manual work. So we saved the regulator time and resources, and so did we also save the healthcare providers. So that's number two. Number three, when we started, I said most of the trainings, and I think Conrad alluded to this, they used to happen physically. Even before COVID, it used to happen physically. Well, it's good for human interaction, but again, if you need to do this in large scale, then it costed the training partners a lot, because they had to replicate the same trainings in the different cities. So what did we realize? Again, there was lack of anyone recording this content or just archiving it. And that's how we came into content production for healthcare. So one of the arms that we have is content production for healthcare. And because we realize we cannot run a platform that disseminates, yet we do not have content that is produced. So one of the things that we do, we produce content from lecture-based to journal articles, to simulation of medical procedures, to allow those who have not access maybe to these procedures across the country to access them. So yes, that's how different we are. And we are growing, and from the experience that we have had and seen with the health workers that are using our platform, we can only scale this to other countries just to get the benefits that they are getting here. Thank you.
Thank you so much, John. This was very informative. And what I've gathered from it is that not only you wanted to democratize knowledge to make it accessible to everyone, and make sure that you just didn't focus on one aspect of care, but all of the aspects, which is very multi-sectoral and very an overarching thinking of like the care system, but also making sure that you have a platform that is working for the regulators and for the Ministry of Health, I'm sure, and for all the people, and you're saving their time, saving their money, and also creating content. So thank you so much for sharing again your knowledge and your innovation. And I will now go to Imodoye, Imodoye, can you hear us?
Yes, I can, Maëlle.
Perfect. Hi, how are you?
Very fine, thank you. How are you?
Great, thank you. Imodoye, data are essential to fight diseases, whether they're old or new. Can you tell us more about your innovation that combines artificial intelligence and speech recognition software, and what made you want to focus on data to improve the lives of people and healthcare system in Africa?
Thank you, Maëlle. I usually don't like starting to talk about Mediverse from the high-tech end because it turns many people off. You say AI, the blockchain, and people stop listening to you. It's, oh, this is some high-falutin tech stuff. But I like starting from where the problem is. So when the MDGs ended and we started the SDGs in 2015, none of the countries on our continent had recorded the health statistics, all of our health statistics, at that time. Not a single one of us had done that. And it just went on to show how large the data gap was. And the reason this is an issue is because public health decisions are being made every day. And the best decisions to be made for the health of the people is data-driven decisions that are made because we know exactly what's going on. Unfortunately, in many of our systems, sadly, these gaps of data are too large. And so generally we just do 1 or 2 demographic health surveys, and then we extrapolate and do a lot of extrapolating to make up, the gaps. And that's where the problem began. We looked at the health system across Africa and we saw quite a number of problems. Beyond the fact that a lot of the health records that we have are still kept in paper-based forms, we have isolated digitization. So let me explain what that means. So the Ministry for Health has a digital record system, but the hospitals have a paper-based record system, or the hospitals have a digital record system, but the morgues have a paper-based system. The morgues have a digital system, the laboratories have a paper-based system. So essentially, we have systems where data is not interoperable. The ministry can't feed off the hospital data, the hospital can't feed off the lab's data, the lab can't feed off the morgue's data. And if that is the case, it's impossible to make a holistic decision because essentially you're only getting one view of the picture. And so that's where the idea for Mediverse actually came in to the space. So my friend actually, I'm a medical doctor. I've been practicing for 4.5 years now. I lost my friend. And that's actually what started Healthbotics. He had a health condition that is quite common in Africa here, called G6PD deficiency. It means people who have it can't use some kind of drugs because if they do, they start to have bad side effects. So unfortunately for him, he did use that drug. He was prescribed that drug by a doctor, actually, who did not know that history, and he began to have the negative side effects. He was seen by another doctor who did not ask the question about that history and was treating him for something else. And so by the time I found out that he was ill, because I knew that history was my best friend, his kidney shut down, he died of multi-organ dysfunction. It was a really painful loss. It was extremely, extremely painful. But after I was done grieving, we'd done the funeral and all that, it really made me sit down and think, if the first doctor who saw him had access to his records, or the second one had access to his records, or at any point in time, his records were anywhere, somebody will have picked it up that he had that problem, and that was where the problem was coming from. And so the idea behind Mediverse is simple. We're creating a piece of software that works with or without the internet, and allows the health worker to have an extra hand when delivering care. And so some of the features in Mediverse are basically designed around that. So I see patients, and on a typical clinic day, I could see up to 70 to 80 patients. Now, for each of those patients I see, I have to write for them. Now, think about documenting 2 pages or a page and a half for 80 people. That's incredible work. And I'm not the only one who does that. That's how the typical doctor and nurse in Africa sees patients on a clinic day. And so that was where the idea of medical speech text came in, right? We looked at the fact that the technology already exists. It's existed for a while now. And so we talk, doctors talk all the time. When I'm on a ward round, I talk to my colleagues, to my juniors, we dictate. So why not use my dictation as my notes? Why do I have to dictate? What typically happens is I dictate and my subordinate writes down. Why? That's two things. I'm dictating and then my subordinate is writing. Why not make that one thing? I'm dictating and the writing is taking place at the same time. The challenge we had when we started with that idea was there was no AI model that was trained on African accents. Clearly, we don't speak the same way Caucasians speak, right? And so when we initially first built the first version of our solution, we used models that were developed by Google and Amazon, and it was terrible. Doctors would say things when we're testing it, and about 60% of it would be right, remaining 40% would be completely off because pronunciations were different. Now, medical terms made it even harder, right? So think about the fact that a laparotomy and a laparostomy are two different things. So it becomes a significant problem, right? And so what we decided to do was, look, we need to create something that is for Africa, right? And so we took on the challenge of building an AI model that used African accents, right? So we recruited doctors in 2 countries, in Nigeria and the Republic of Benin, because we wanted people who were primarily Francophone speaking and people who were primarily Anglophone speaking. And so that was the idea behind that. So we recruited doctors across these 2 countries, and we gathered together about 600 hours in total of medical dictation, and we began to train the model with that data, just trying to get the data to be, we're still doing the training to today, it hasn't actually stopped. But by the time we get pilot testing, we're about 85% word accuracy. So essentially about 85% of the time, the model clearly understood what you said and dictated and recorded it correctly in the electronic medical record. So that was the idea behind that. The thought was simple, and we started piloting it with 9 hospitals in Nigeria. The documentation time has gone down. With Mediverse, a new patient documentation went down from 45 to 25 minutes. So we, in one fell swoop, we saved the health worker 20 minutes on each patient. So do that over 80 patients across the day, and come on, you're giving back someone their lives. And the thing behind Mediverse as the solution is that really it helps us fight one of the core problems that is destabilizing our health system, which is the brain drain. We're going to talk about financing healthcare today. We're going to talk about, how we need more money in the health sector. But the truth of the matter is we don't even have enough health workers. And that's not the problem. It's not stopping because we're losing them by the day. One of the things I always share when I talk about Mediverse is that Africa has a $3.17 billion problem that is divided into 2 parts. 1 billion lost every year to medical brain drain. So doctors and nurses leaving after receiving training in African countries to other countries, and another $2.17 billion lost to medical tourism. African patients leaving Africa and going abroad to spend money on health services that they could get in Africa if we could improve the quality of care. And so Mediverse essentially is looking at that $3.17 billion problem and saying, look, we can't keep hemorrhaging this amount of money every year and say we want to have a sustainable health system. It's just not possible. We have to stem the tide. And so that brings us to the second feature of Mediverse, which is where the blockchain and machine learning come in. So what Mediverse allows is sharing of data. Now, before Mediverse, there's a global problem with health records, even in the US and in other advanced countries. Health record providers don't like sharing data. And the excuse is always that it's not secure. If I give you access to my patient's data, how am I sure your systems are going to keep that data safe? And so we began to really look into that, and that's where the blockchain came in. So Mediverse is built on a digital ledger or a blockchain called Hyperledger Fabric. And what it does is this. It allows people who are given permission to share this record, right, to share it without being worried about the compromise of the data itself, because the blockchain essentially has some inherent features that make it more resistant to cyber attacks than other systems of data storage, right? It's a bit technical, so I probably would have bored the audience with that. But the point is, for the time, with this piece of technology, we can authenticate people who need access to this piece of information and allow them get access to it. And these people could be researchers, public health institutions like the Ministries of Health, independent evaluators of healthcare like international NGOs, and even individual policymakers can get access to these pieces of anonymized data, right? And without worrying that they are compromising people's health information. And that's what Mediverse really brings to the healthcare system. And obviously the last and probably just as important is the clinical decision support, which basically allows doctors in the consulting room to have another brain. And so I'm not trying to figure out what are the differentials for this patient based on the history I've taken. If you've taken that history with Mediverse, algorithms will help you put together that history you've taken and compare it to when similar histories have been taken in the past. What was the diagnosis? And so you have a starting point, right? You're not alone in the consulting room. And people don't understand how hard this is. I'm a doctor, so it kind of is a bit passionate for me. You're in a room and you're asking yourself, what is wrong with this patient? It's really, you're under pressure because that patient trusts you 100%. You must come up with an answer, right? And right now, you just need something to give you a clue of what could it possibly be. And many times it doesn't exist. You're basically on your own and you have to come up with a diagnosis. And it's not really fair to expect doctors or nurses to always do that. And so that's where the clinical decision support feature of Mediverse comes in, by giving them that extra brain in the consulting room when they're about to make the diagnosis that will improve the life of the patient. So that's really what drove us into looking at data-driven healthcare and obviously building Mediverse with some of the features that we put in there when we were designing the system. Thank you.
Thank you so much, Imodoye. So just to sum it up very quickly, because there was a lot of very impactful and interesting information. So sorry for your friend. Second of all, writing the prescription or the medical files of 70 to 80 people a day, you're a writer, you're not a doctor. And third of all, thank you for making this African version of Siri alive. I think we might need it outside of the medical world, and also very, very important to have data-driven decisions, the decisions that are evidence-based by data for old and new disease. So thank you so much. And I'm very conscious of the time in the next session that we have with our colleagues after. So I'm turning to John now. John, in 1 minute, can you please share a message, or what message would you like to pass on to the young people who are listening right now and watching us and maybe struggling to develop their health innovation? John, can you hear us? Nope. Well, well, Imodoye, I'll come back to you and maybe John will catch up later. So Imodoye, in 2035, 35% of the world use will be African. Is it therefore imperative for the continent to develop innovative sectors in the long term to create jobs for the next generation? What message would you like to share with our decision makers of today and tomorrow so that they can prioritize funding dedicated to higher education, but also research and development?
Right, thanks. So essentially, this is a no-brainer, right? Just to put one piece of statistics out there, by the end of 2022, technology alone will create 127 million new jobs by the end of 2022. Yes. And so you begin to look at the countries who've made that leap from developing to developed, Singapore, South Korea, and and some of the other countries, India, who've made that leap from being where they were to where they are today. And one thing that underlies all of them is heavy investment in education and research and development. Recently, Indian CEOs in Silicon Valley have been a toast of the world. About 8 of the top 20 companies in Silicon Valley are headed by Indians who were trained in India and then came to America. That's not magic. That's a systemic decision made by decision makers to invest in something that clearly gives us return on investment, like education and research and development. I always use this example of the ATM. Before the ATM came in the US, there were 300,000 tellers and 2,000 ATMs. After the ATM came, there were 500,000 ATMs and 600,000 bank tellers. So not only did the technology come, it also brought new jobs with it. That's really why investing in R&D and education is almost always a no-brainer, because not only does it create new jobs, it brings with it new lifestyle changes. Using Mediverse as an example, African doctors before we came, speech to text probably wasn't something that many African doctors would think about. We're here now, and I can tell you in 5 years, it will almost be unheard of that a doctor is still writing. That's what we hope to achieve. We believe that it should be a question of, oh yeah, I just voiced in my notes and I'm done for the day. So that's what technology does for you. It brings in a new way of doing things and also brings in opportunities like job creation and things along with it. So my call to action today, my charge today is this return on investment has been demonstrated in contexts that are similar to ours. Countries that were like ours before have invested in this and have made that leap to the level we want to go to. So we need to follow those who've gone along that route. We need to follow them. Now is the time for us to invest in this youth population, in their education, and in training them on how to solve problems.
Thank you so much, Imodoye, and I totally co-sign your call to action. John, can you hear us?
Yes, I can hear you. Can you hear me?
Yes, perfectly. Thank you so much. So I'm going back to your question. As a young African innovator, what message would you like to pass on to the young people who are listening to us right now and watching us, and who might be struggling with developing their health innovations? And because we're conscious of time, please make it 2 minutes. Thank you so much.
Thank you very much. Number one, I'll start by alluding to the words you mentioned earlier when introducing this session. When you began the this award program, you received over 300 award applications. This shows how much opportunity of health innovation is in Africa. It's endless. The challenges are enormous, and so are the opportunities. So once we realize that, we know that necessity is the mother of invention. Where you see a challenge, that's where an opportunity lies. One has to first understand the sector. That's one thing I just need to tell you, especially if you're an outsider. And outside here, I mean, there are a lot of tech people coming into the space. You can't just solve a problem you don't understand. You have to have someone to work with you. And for my case, I have a doctor who have walked this journey together. And the other thing I also need to just mention is this: health sector has so many players. So many players that are involved in health sector. And again, when you're doing your innovation, you have to consider who it affects, who it complements, and all that in consideration has to be, you have to consider that. Number three, the health sector is heavily regulated, all right? And understandably so, because the kind of service and the services it offer to the humankind. And when you're doing so, you have to consider a place for regulators, because they have a big say in anything that goes. When you've listened to Conrad and you've listened to Imodoye, you can tell. Whereas we can have a lot of solution proposals and solutions down here, some of them, for them to make an impact across the country and across the region, they have to get a nod from the regulators. So anyone thinking about innovations in health sector have to think. You cannot think outside without considering the regulators in this. And lastly, I want to say this. These solutions that you make, I know some of the solutions, they may not be very unique in other parts of the world. We have to custom make solutions for our own challenges. One of the things, just picking solutions from the West or from other regions and placing it here, some have seen terribly failing because our challenges are unique and so are our people. Our knowledge and the technical know-how of our people as well is something you have to consider. If it's something that you have to be used by different audiences, then you have to consider their knowledge, you need to consider their level of education, but you also need to consider, is it solving the African problem the African way? Thank you.
Thank you so much. I wonder if you were a philosopher in another life, but I'm sure you were. Thank you so much, John. Conrad, can you hear us?
Yeah, I can hear you guys very well.
Great. So I'm turning to you for the last question of this very informative discussion. In your opinion, how can our continent, our populations, and especially our youth play an important role on in global health security?
I mean, I'm enjoying everything John just said, and just to add on that, for a long time we've been saying our problems are actually opportunities, and I think the youths get that, especially in healthcare. We've had Ebola, now we're talking about COVID-19 and what else is going to come. But I would like to say in every situation, there are two angles. There is the passive angle and the active angle. So it depends on where the youth engage themselves in. If we keep on criticizing, talking, and ironically speaking, backing, it doesn't help. So we should move towards the active side. We should actually start biting. And that's what I'll say the youth should get involved in. Change the mindset. Be brave enough to do things, to try out things. John, Imodoye, and I are clear examples to show that youths can do things, can build things which are unique, which are working, and which can create impact. But we need a closed ecosystem. For example, if John's solution needs to work in Senegal tomorrow, he needs to know how he's going to get paid back in Kenya. But John is not going to build this financial tech solution, for example. Neither are the central banks going to come and think about how is John going to get his payment. Young people need to get engaged because it's a closed ecosystem. At the end of the day, we need each other, everyone doing his own part in his own sector, and together that's how we move. So brave the challenges, don't be scared, don't be afraid to fail, and let's build together.
Great, thank you so much, Conrad, and thank you, really, Imodoye and John for this discussion. I really hope this this was appreciated by the public, because this was very informative to me, and I feel very energized by your answers and your passion, and I'm very happy that you're the three winners of the first Young Innovators Award for Health. Yeah, this was very important discussion. And I will make sure that we are all connected in the future. I've sent the link to the award platform. Thank you also, Dr. BENDHAOU, for being with us and making this opening remarks. Very happy for the partnership between IFPMA and Speak Up Africa. And when you hear from young people like all of you guys, we really understand why we're doing this. Emphasis on guys, because there is no woman winner, and this is a little transition for me. I mean, no shade to you all, but we were kind of, sad that there were no women in the three winners. So because of this, we created the Women Innovators Incubator, and there will be another session on the Thursday, December 9th at 11 a.m. GMT. So please tune in. You guys, these are your women counterparts. They are as amazing as you are. I think two of them are from Uganda and one of them is from Rwanda. But yeah, it's really a great award, and I'm very happy to have been able to facilitate this session. Thank you all also to the Gallian Forum, and I hope to see you guys soon. I'm tired of COVID, and I hope that we can all meet and really can continue to brainstorm and support young innovators. So thank you all.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Pour la 4e année consécutive, le Forum Gallien Afrique se déroule en terre sénégalaise du 7 au 11 décembre 2021. Le Forum Gallien Afrique offrira une plateforme d'échange exceptionnelle autour du thème « L'Afrique se mobilise pour la sécurité sanitaire mondiale ». Placé sous la présidence effective de son Excellence Macky Sall, président de la République du Sénégal, le Forum Gallien Afrique réunira des experts scientifiques des secteurs de la santé, de l'environnement, d'éminentes personnalités politiques et de la société civile, d'anciens récipiendaires de prix Nobel et des centaines d'étudiants en médecine. Cette 4e édition du forum, avec 3000 participants, sera organisée en format virtuel et placée sous le signe du leadership des femmes et des jeunes, avec du 7 au 10 décembre 2021, un forum des jeunes, un forum des femmes et un forum scientifique. Le samedi 11 décembre 2021 se tiendra une cérémonie en présentiel pour célébrer les 50 ans du Prix Galien International et le Golden Jubilee. Au cours de cette cérémonie, pour la première fois, le Prix Galien Afrique, qui consacre la recherche, l'innovation, la santé et la technologie, sera décerné. Du 7 au 11 décembre à Dakar, le Forum Galien Afrique célèbre la santé, l'innovation et la recherche en Afrique.